You're listening to Healthier Living with Lisa DeMaselli on Northwest Jersey's own RNJ.
And welcome back to Healthier Living. This is Lisa DeMaselli, Manager of Community and Donor Relations with the Foundation for Hackettstown Medical Center, and my guest co-host, Anna Scalora, Director of Marketing and Public Relations with Atlantic Health System. So, Anna, almost a quarter of the way through the show already. It goes quickly, doesn't it? We tell our guests that every time.
It sure does.
So, Dr. Rao and Dr. Khot from Advanced Care Oncology and Hematology Associates, thank you very much for joining us today.
Thank you. Thank you, Lisa. Very excited to be here.
Dr. Rao, your practice came into the Joan Knechel Cancer Center
about a year ago,
I was
Lisa.
going to say fairly recently.
Right. I mean, our practice was founded about 7 years ago. We have now grown in the 7 years. We're over 15 providers, doctors and nurse practitioners. We are in 4 counties. And a year ago, around July 2017, we decided to expand into Warren County, specifically at Hackettstown Medical Center, Joan Knechel. And simply put, it was driven by a need from the community. You know, the patients, a lot of our patients we were seeing in other locations, including they were driving an hour or two to go to other centers like Morristown Medical Center. They requested us to come here. A lot of community doctors said we need, more high-level oncology care. And that led to us starting a little over a year ago. And we were on the show a year ago kicking off our practice, and now we're pleased to say that in over 1 year we have served over 2,000 patient visits to our practice in the Joan Knechel Cancer Center, and over 1,500 infusions for treatments, both chemotherapy as well as benign infusions. And the response from the community has been, really heartwarming, overwhelming, both from all the primary doctors in this area as well as from cancer patients.
So do you have representatives at the Joan Knechel Cancer Center every day? You have providers? Or?
Yes, Dr. Khot can tell you a little bit more.
Hi again. I mean, it's a pleasure to be here at the WRNJ radio station, and thank you so much, Lisa and Anna, for having us here. So I'm there on Tuesdays at the Cancer Center, and Dr. Rao and Dr. Shah are there on Thursdays, and we are going to add actually another day just because of the overwhelming response we've had here from the community, from the doctors, as Dr. Rao had mentioned earlier. And it's been very heartwarming. I look forward to coming here. It gives me a pleasure that I'm coming to this office this day, and I look forward to that week, to come and serve the community. It's just been very humbling, and very rewarding.
And, we look to expand our services here. Although we're here a few days, we'll be here almost every day of the week by 2019. And the infusions run every day. We have nurses. We have 360 care, I'm proud to say, at this facility, including radiation oncology, whether it's radiology, PET scans, state-of-the-art biopsies. We have genetic testing, bone marrow biopsies, nutritionist support, palliative care. So we are very pleased that in 1 year we were able to bring a really robust, all-around 360 cancer care to this community where they really shouldn't have to go outside or travel for most of their needs. Now, if there's specialized things that come up, we have partnered with, as you know, with Atlantic Medical Center, and we are part of Atlantic Medical Group, AMG. So we have specialists that we can call upon. We have built relationships with at Morristown. For example, we have a patient, Alan, who lives literally around the corner from Hackettstown Hospital. He can walk to the hospital, but he was recently diagnosed with very rare 2 cancers. He had cancer of the gallbladder as well as the pancreas, and he needed a very specialized surgery, and only a handful of people, surgeons in New Jersey, have the capability to do that. But we were able to hook him up with our most expert surgical oncologist at Morristown. He had his very extensive surgery there. He did well, but subsequently was able to get his chemotherapy right here in his community at Hackettstown Hospital with us. He's completed all his treatments. It was easy for him to navigate to the system. It was a very warm, welcoming place. For those of you who've come to Joan Knechel, you walk in and we almost say there's like a spa-like feeling. You come in, it's very welcoming. The nurses are wonderful, and he is in remission now. So these are the kind of stories that really speak to the high level of care we can provide here, even if patients had to go elsewhere for 1 or 2 things that are not available in our hospital.
That is a great story. And Anna, I know you're always proud to talk about the seamless access that's provided through Atlantic Health System.
And it's so critical, I think. Dr. Rao, tell me what you think about the strength of a community hospital's oncology program. What does that do for patients locally?
Yes. Thanks, Anna. I mean, we have talked about this with our patients and with the doctors in the area, that more and more oncology is becoming very sophisticated. It's becoming very specialized. And within our practice, we have specialists that can bring that. Dr. Khot, for example, does a lot of urology cancers. He does lung cancers. I do breast cancers, gynecological, and lymphomas. Dr. Shaw in our group does leukemias, and Dr. Strauss does GI cancer. So between all of us, we are able to really make sure that every patient gets what they need, and we are able to call upon the multidisciplinary tumor boards, the cancer conferences that we have in Morristown, discuss these cases there with a wide group of doctors that have additional expertise, and make sure that we come up with the right and customized care for that patient. We were talking earlier about genomic medicine. I mean, that is the future where we make sure that every patient gets this cutting-edge genetic profiling of their cancer. For example, one of our patients, Anne-Marie, who's a local of this area, I think she's like a several generations Hackettstowner, who was one of our early patients who convinced us to come and open our office here. And she has lung cancer, stage 4. Because of genomic profiling, we were able to identify that she has a specific mutation that could respond to a targeted drug, oral drug. And she's been doing very well on that and for a number of years. So we have, these are the kind of, multidisciplinary sort of, we can call upon the strength of our partners, so to speak, our healthcare partners within Atlantic and other institutions. And
just to add to what Dr. Rao said, I mean, we are all trained at very highly renowned institutes around like the New York, New Jersey area. We have a lot of good relationships with doctors at Columbia, at Memorial Sloan Kettering, where we can call upon them and discuss run-bounce ideas about like patient care, and we can give the care here right in the community, where patients don't have to travel all the way to these institutes or spend days getting an appointment, where we can facilitate all that for them, and access to clinical trials where, I mean, just an example, I treated a patient with lung cancer after her surgery here in the community, gave her the chemotherapy, and now I could enroll her in a clinical trial which is very upcoming now with immunotherapy at Morristown Medical Center. So Atlantic Healthcare has so many trials where we can access them for the patients here in the community and kind of guide them there, because it's a very tough journey for a patient to go through. Very emotional, physical, not just for the patient, but also for the family members, the friends, and we want to make that as easy and as comfortable as possible.
Sure. As I've said many times and thought many times, the last thing you want to do when you're not feeling well, as you're trying to battle an illness, is to be on the road or asking for favors to get to travel for treatment. So I've been with Hackettstown Medical Center since 2004, and that's the year that the Joan Knechel Cancer Center opened. And I have to say it is heartwarming and encouraging and just fantastic to see the level of expertise available, frankly, like never before at our cancer center. There's truly treatment for everyone there. And in such a high level with technology to boot. And I'm so glad, Dr. Khot, that you brought up that point about the conferring that goes on, that people can have that high quality expertise locally. With,
And again, relationships matter, and we do have strong relationships with like major institutes in the area where we can get that benefit to the patients right here. And we, as all our team members, are very established in certain cancers. Like I do a lot of bladder cancer, kidney cancer, or prostate cancer, and I can use that expertise here in the community. I'm doing a lot of immunotherapy here, and there are stories where basically patients are cancer-free, where initially they were uncurable from their cancer, with stage 4 cancer getting cured or going in complete remission with chemotherapy. And immunotherapy together. Yeah,
that's so encouraging. Yeah. Let's hold that thought. I hate to break the momentum of the discussion, but we need to take our next break. We'll be right back with Dr. Maitali Rao and Dr. Ashish Khot, Anna Scalora, right here on Healthier Living.
More Healthier Living with Lisa DeMaselli when we return on Northwest Jersey's own WRNJ.
Northwest Jersey's own RNJ.